then what I'm gonna do, I'm gonna turn off the video and share my screen. Okay, can someone allow me to share my screen?
Yes, you're done. Can you try now?
Yep. Can you see my screen?
Yes.
Right. Okay, so I was just trying to fix a little bit more noise out there. Okay. So today, what we are going to discuss a little bit about my career journey from clinical medicine to medical illustration. I would call it a passion-driven career journey. And also, I'm going to introduce you guys to this unique discipline called medical illustration. So Maya Angelou is a American poet. So I'm just going to quote her words. My mission in life is not merely to survive, but to thrive, and to do so with some passion, some compassion, some humor, and some style. I like this quote. This quote is about passion, compassion, and living a more active life, if you will, not passive life. So talking about my career journey, 2010, 11, I graduated from my med school. I worked as a doctor back home in Kerala. As the host described, I was a medical officer in one of the health center in Palakkad. So I just had my bachelor's degree in medicine. So I already heard a couple of talks, couple of doctors giving talk on Team 2 venue. So I don't know who all are into medicine, engineering, but I hope most of the people here are in college or trying to develop in the early stage of their career at least. So I'm just gonna give my story so you can take something from it, maybe omit something. So I was having my bachelor's degree and working as a junior doctor, medical officer and all. And I was keep, puzzling to pursue my master's. So I was kind of stuck. I don't know which way I have to move forward. My elder sister was a very successful doctor, pathologist. So she used to ask me this question, Fuad, what you gonna do? Are you not going to take an MD, right? You should have an MD. You should be some bone doctor or skin doctor, brain doctor. You have to focus on something. So, but the fact was, I was not very interested in clinical field. It's ironic, I studied the whole medicine. So, but there were different options like non-clinical field, like pathology, anatomy, and so on. But I was asking much bigger question at this point of time in my life: who am I? So, who am I from a career standpoint, from a career perspective? And the answer was pretty clear and straightforward, thankfully, in my case. I was an artist from kindergarten to 12th grade and beyond. I always won, a lot of prizes, awards. I went to this zonal competition, district competition, state competition, you name it, everything, pencil drawing, painting, cartoon, and also on stage items, the drama and all sort of stuff. I was always an artist. To my friends, I was an artist turned doctor. So I was, reading, watching YouTube videos like any of, the new generation the kids, right? I've been doing the same. I'm trying to figure out uh, which path should I take. So at that time, I actually came across this discipline called medical illustration. And medical illustration means basically medical art, medical artist. And that was like, wow, okay, this is, I always wanted to pursue something in art. And I never thought there is something within medicine which is, more aligned with my own skill set and passion. So that was my journey. That was like 4 or 5 years ago. I was, average or maybe below average doctor back home, and I wanted to uh, pursue this medical illustration. I went to art school. I tried to push my artistic skills, and I came up with a portfolio. I sent to different universities who have medical illustration program here in United States, and I've been fortunately accepted to one of the best universities uh, in medical illustration field. It's RIT, Rochester Institute of Technology. I graduated from there. I worked in Johns Hopkins Medicine for a year, and Johns Hopkins Medicine is a big deal. It's a dream of many doctors. I worked there for 1 year. I created a lot of illustration. Right now, I work in Baylor College of Medicine, which is a part of Texas Medical Center, which is the world's largest medical center. And I created illustration for peer-reviewed, world-famous medical journals like JAMA, Journal of American Medical Association, Elsevier Publishers, European Journal of Gastroenterology, so on and so forth. So, if we wanted to follow our passion and try to incorporate our own skill sets and strength to our career path, I think it'll be much more easy, and you'll be willing to put in more effort in the long run. So that's a gist of my whole career journey. Uh, so I would introduce you to the field of medical illustration since I'm passionate about it. That's my career. Um, so I'm gonna give what in which whole domain the medical illustration is useful, right? Um, so that's a skull I drew from my college in, I guess, in 2017. So one of the domain where medical illustration is very useful is medical education. So back in med school, I learned human gross anatomy during my first year in med school. The same, human gross anatomy, I've studied again as part of my master's course here in Rochester, New York. And this time I referenced a book, Dr. Frank Nutter, who is again a medical illustrator, a surgeon turned medical illustrator. And he illustrated wonderful books in anatomy, histology, and a couple other subjects with beautiful paintings and illustration. As you can see in the slide, this is his anatomy textbook. And I used to study from these textbooks, and this time my learning was much more different, right? With these illustrations, my understanding, it was easier to comprehend the information and also recall the information, and the understanding was very deep. So this is again a literature, like a text of something called thyroid hormone synthesis. We all know what is thyroid, right here in our throat. There is hypothyroidism, hyperthyroidism, different diseases, right? So this is a text. So it's obviously, if you look at it, it's hard to read everything and understand. So at the same time, this is an illustration I created for that literature. So if you look at it, it's much more easier, right? You wanted to approach it. You wanted to see, okay, what's going on. So that's how useful is the visuals, the illustrations. Studies have already been published a lot. I only included very few here. So illustrations really help in learning, reading, and so on. So something new again in medical art or field of medical illustration is technology. There is already 2D animation, 3D modeling, 3D animation, but a bit advanced would be shown here in slides: virtual reality, augmented reality, mixed reality. So something like surgical simulation. So what is surgical simulation? As you know, the pilot, before flying a flight, they got a lot of simulation. You know, that they have to go through hours and hours of training in simulation center. Likewise, before surgeon, even before assisting surgery, if they get a chance to do all these procedures using virtual reality and augmented reality, that would be a good training, right? And here I'm going to show you a video which is created by a couple of medical illustrators and other technicians. And this video is about training medical staffs in something called operating room fire. So I'm going to just play this.
Okay, I've made the initial incision and I'm ready to dissect tissue around the thyroid with the electrosurgical pencil. Anesthetist, what's the percent oxygen going to the patient?
100% right now, doctor.
I smell smoke. Does anyone see fire? I'll control the bleeding. Get the fire!
Doctor, I've stopped the flow of oxygen.
Okay, the fire is out.
So, as I said, this is OR fire, operating room fire. This is a very rare phenomenon, but it's possible. There has been death reported here in the United States from operating room fire. As you can see, they were introducing oxygen. Oxygen is a conductor of fire, and there was this hot riser which actually produced sparks, right? So there is a chance of fire. And when the fire is coming, medical staff has to be trained. And how are we going to train? Can we put a patient on fire and train? No, that's not possible. So this, you know, medical illustration and these technologies could help in this kind of situations. Moving forward, one other domain where medical illustration again helpful is communication. I'm sure many of you guys maybe went with parents or with your own problems to doctors and you don't understand many things. You see, look at this picture. What do you understand? So it's hard. So this is actually brain aneurysm, right? So many pictures, even for doctors. So these are specialists called radiologists who actually look into radiographs and interpret what's going on there, right? So even for doctors who is in different discipline, would be hard to interpret these details. And how about lay person? How about a patient? So these things, again, medical illustrators comes into help here, right? So we take those pictures into something called Osiris, a software, and we get the 3D model. And then if you look at the right, this is again a painting I've done. So we digitally paint using softwares like Adobe Photoshop, Adobe Illustrator, where right now you see there is like a dilation near the head, like a like a balloon. So that's actually called a brain aneurysm. It's a dilation of blood vessel within the brain, and it's very dangerous. It's fatal. So if you go for some scan, you find out, and you communicate then with the patient. If you have this kind of figures illustration, that becomes much more easier. The communications become effective, and not only with patients, also with fellow residents, fellow other doctors, and so on. Again, here's a beautiful illustration. Here's Peter M. Lawrence, one friend of mine. He's award-winning medical illustrator, again showing a surgical intervention and treatment of a problem called brain aneurysm. One of the use medical legal case and legal illustration. Again, if things go bad within the hospital and things end up in front of a jury, again, in the court, the judge and other members, they are not medical experts, right? So we have to, as a medical illustrators, we comes in and explain this is what actually happened, right? We colorize different parts of the body, and we show this is actually happening, and it helps in a much quicker judgment. So this is an illustration I've created for a lesion in brain. Here again, another illustration I created, again, medical legal illustration. This patient had to go through multiple surgeries for this patient's finger, and as part of that, this patient got a problem with his finger. Right now, this patient wanted to get, they basically wanted to file a case against the hospital for the trauma the patient has experienced, right? So we wanted to help him out and portray the problem in front of the jury. So that's all, and specifically what I've been doing right now is I create a lot of illustration for medical journals. So it's we trying to explain what scientists bring up in the literature in terms of visual, right? We're trying to simplify, break down the text and the literature part of manuscripts and journals, so which it will be much more accessible for fellow doctors, fellow scientists, and all people who are interested in the field. So I think that's it. A short explanation of medical illustration and a very brief story of my career. So last few words. It's always good to follow your passion, strength, and skill set. And also, if you at the same time, if you look at me, I didn't completely switch my profession. I'm still in medicine. I'm doing clinical research. So I didn't completely get rid of something. So always, if you even if you're following passion, from my experience, you try to do something within your career, right? You already invested 5 years in something, so don't scrap everything all of a sudden. And if you are willing and courage, you can scrap. That's fine. But my experience, from my life, what I understood is it takes time to be successful in any career. So you have to invest a lot of years. So it's better not to scrap anything altogether, but try to find something within profession which is more aligned to your strength and passion. Thank you so much.